All right, so let's have a look at this second one. So this is a discharge summary by one of the junior medical officers of an older fellow, not that old, who presented with unstable angina. Probably doesn't matter so much what they presented with. The first thing that I notice about this is that they've numbered it very helpfully, but their numbering is rubbish because it's not like, why would you put gout before heart failure in somebody who's come in with unstable angina? So the first thing that I'm going to do with this is just, oops, how can I not? Is that read only? First thing I'm going to do with that is, what did I do there? Oh, I hate it when it does this. Right. All right. So let's actually put this into some degree of logical sequence. So I always put the vascular diseases together, and the vascular diseases are the commonest things which are problematic. So let's put the vascular stuff here. 100 pack years of smoking is sort of important for the vascular diseases. I'll put these, no, I don't want to move them. Well, bypass is sort of important as well. So what do those other ones say? Ischemic heart disease. Right. So here's a person who's got vascular risk factors, and as a result, they've got ischemic heart disease. They've got ischemic heart disease. So there's no point in having big long words. That's what abbreviations are for. So they've had a heart attack of some sort, doesn't tell us what that is. And that's led on, or at some stage, they've had a bypass. So we don't know how many bypasses they've had. There's no severity scoring in this. We don't know whether they had one vessel or whether they had 5 vessels bypassed. Did they use arterial grafts, which are going to last for a long time, like a left internal mammary and a radial artery graft, or have they done vein grafts, which will start packing it in after sort of 2 to 10 years? So anyway, it doesn't tell us an awful lot of extra information about, oh, there's good old CCF. Right, so they've got some heart failure in there as well. Let's put some heart failure there as well. Important to know. The vascular complications are sort of important in terms of what they've had done to their vessels, but ultimately the outcome is what's their pump like. And if their pump is buggered, then that's actually important to know. Interesting, we've got some COPD, not surprising with 100 pack years of smoking. But again, there's no severity scoring here to tell us exactly what's going on with these So we'll see social alcohol consumption. Yeah, okay. We'll put that down the bottom, but it probably doesn't apply so much to our patient at the moment. So they've had a couple of operations. They've got a bit of gout. They've got some reflux, which is sort of important if they're on blood thinners. And they've got some airways disease. So let's have an idea and see if we can figure out a little bit more about what's going on here. So the medication list, I always start, we'll put all the cardiac drugs together to start with. There's fentanyl, there's aspirin and perhexylene, nicorandil, clopidogrel goes with the aspirin, so we'll put that up there. All right, let me paste. Fenofibrate, so we'll put that with the simvastatin. So double antilipidemics. Move these down a little bit lower. Insulin rabesperazole and furosemide. So furosemide's important because it tells us what degree of heart failure they've got. So they're on no ACE inhibitor. There. So what have we got? We've got anti-lipid drugs. We've got anti-blocking artery drugs. We've got preventers of ischemia. And then we've got quite a few. Amlodipine a strange drug. Why would you have somebody on amlodipine, which causes ankle edema, and then have them on 40 milligrams of furosemide? Why wouldn't you, if that's an antihypertensive, why wouldn't you have them on an ACE inhibitor or irbesartan? Anyway, I guess there's a bit of work to be done. Oh, we got another couple of drugs there. Allopurinol and metformin. All right, so we'll come to these ones first. So we've got preventer. We've got something that stops them having ischemic heart disease. We've got them on an antihypertensive, which is just a single therapy. Perhexylene and nicorandil are drugs that you don't see that often, and you see them used in people who have got terrible arteries. So I suspect that this person's got quite severe coronary artery disease. And may well have quite a number of bypasses. But they've only got mild heart failure. If they're on a negative inotrope and a small dose of furosemide. So that's pretty much the cardiac drugs. We've got a single puffer. Usually people who have got severe emphysema are on what do you call it, ipratropium or some sort of vagal inhibitor, anticholinergic. So I'm assuming that the COPD is sort of mild to moderate. Spirometry would be the ideal way to confirm that, because the COPD gold criteria for 2018 says spirometry and symptoms, but we've got a limited amount of information here, so we can add in the puffers. Oh, hang on, umeclinidium. What am I saying? Oh, so actually they may well have moderate. Somebody who's got mild COPD, you're not going to have two puffers a day. All right, so they're on fentanyl, and I'm not sure why. Sort of important if somebody's got significant lung disease to, when you've got them on a narcotic, at least they can't overdose on patches. And then we've got metformin, so an oral hypoglycemic, and some insulin. Now the reflux disease, they're on a regular PPI. So presumably they've got reasonable reflux disease. You know, when you're on double antiplatelets, you actually would probably want to have somebody on some sort of gut cover. So if we were to summarize this, it looks like we've got somebody who actually has quite severe vascular disease, certainly only in their coronary arteries. We haven't got evidence of cerebrovascular disease, renovascular disease, or peripheral vascular disease. And they've got some mild heart failure. I'm assuming they've got some moderate COPD because they're on the double puffers, which are the only drugs that have been shown to improve mortality in COPD. And then they're on a fentanyl patch for presumably for whether it's arthritis or back pain or something like that. A couple of drugs for their diabetes, PPI, and some allopurinol. So that gives you more of an idea of what's going on with this patient. So probably a moderate, significant vascular path with some moderate COPD. The COPD, in a setting of unstable angina, the COPD and these other things are probably less important. And you could probably just say 67-year-old fellow with unstable angina who's a significant vascular path and has had, is on, I mean, depending upon what his heart rate is, if he's adequately beta blocked, he's probably approaching end of, the top of the therapeutic ladder from a medical treatment point of view. That's a lot of medications. Okay, we'll move on to number 3.